The next time you urinate, whether that's in 5 minutes or 5 hours, I want you to do something you've probably never done before. Stop multitasking. Put your phone down. Don't stare at the wall. Instead, I want you to watch exactly what happens. Count how many seconds pass from the moment you relax until the stream actually starts. 1 Mississippi, 2 Mississippi, 3 Mississippi. Listen to the sound. Is it forceful water hitting water or a gentle trickle? Watch the arc. Does your stream project outward in a clear arc, or does it drop almost straight down? Notice when it stops. Does it end cleanly, or do you stand there for another 10, 15, 20 seconds with dribbling you can't control? Most men have been urinating the same way for 40, 50, 60 years and have never once actually observed the mechanics of what's happening. But your stream is not just about emptying your bladder. It's a real-time diagnostic readout of what's happening inside your body, your prostate, your urethra, your bladder muscle, your pelvic nerves, and the specific pattern of your stream, not just weak or strong, but the exact sequence of what happens, tells a trained urologist exactly where the problem is and how urgent it is. I'm Dr. Jane, a urologist with 18 years of clinical experience, and in the next 18 minutes, I'm going to teach you how to read your own urine stream the way I do in my clinic. We're going to do 3 self-diagnostic tests you can perform tonight in your own bathroom, no equipment needed, just observation. Then I'm going to show you what each pattern means, what's causing it, and exactly what to do about it. By the end of this video, you'll know more about your prostate health than 95% of men your age, and you'll know whether you need to act this week, this month, or just monitor. Before we begin, if you've noticed your stream has changed and you want real answers, hit that like button right now, subscribe, and turn on notifications. We release evidence-based, no-nonsense content every week for men over 60 who refuse to guess about their health. Drop a comment and tell me where you're watching from. I love seeing how far this community reaches. Now, before we do the self-tests, we need to establish what normal actually looks like, because most men have no baseline. Here's what a healthy urine stream looks like in a man between 50 and 70 years old. Start time. Stream begins within 2 to 3 seconds of relaxing. You don't push, you don't strain, you relax your pelvic floor and urine flows almost immediately. Force. The stream arcs outward at least 6 to 12 inches from your body before gravity pulls it down. The sound is distinct. Water hitting water with force, not a gentle pour. Consistency. The stream is continuous and maintains pressure from start to finish. It doesn't start strong and fade to weak halfway through. Duration. For a typical void of 300 to 400 milliliters, that's a fairly full bladder, the entire process takes 20 to 40 seconds from start to complete stop. Ending. When the stream stops, it stops. You might have 1 or 2 small dribbles immediately after, but urine doesn't continue leaking for 10, 15, 30 seconds while you stand there waiting. If every item on that list describes your current stream, your prostate, urethra, and bladder are all functioning well, you're in the normal range. But if even one of those items doesn't match your experience, your body is telling you something specific. Now let me give you something most doctors never tell their patients. Most men assume a weak stream means a large prostate. That's not always true. I've seen men with 80-gram prostates, double the normal size, who have perfect streams, and I've seen men with 35-gram prostates who can barely urinate. Size is not the whole story. What matters is where the prostate is growing, how it's compressing the urethra, and whether your bladder muscle is still strong enough to compensate. Your stream pattern tells me all 3. Let me tell you about a patient I'll call Robert. Robert, 67 years old, retired accountant from Phoenix, Arizona. Robert came to my office 6 months after he first noticed something different. His stream wasn't weak yet, but it wasn't the same. It used to start the instant he relaxed. Now there was a delay, 5, sometimes 8 seconds of standing there before anything came out. His friends told him, "You're almost 70, that's just what happens." But Robert is an engineer by training. He told me, "Doc, I know my body. This isn't normal. I just don't know what it means." We measured his prostate, 42 grams, mildly enlarged but not severe. But here's what the ultrasound showed. His prostate wasn't growing evenly. It was growing specifically in the median lobe, the part that sits right at the bladder neck where urine exits. Even though his total prostate size was only moderately enlarged, that median lobe was acting like a trap door, partially blocking the opening. That's why he had hesitancy, but still decent force once the stream started. The obstruction was positional, not total. We caught it early, and that made all the difference. Now, here are the 3 self-tests I want you to do. You can do all 3 tonight. Self-test number 1, the hesitancy timer. The next time you feel a normal urge to urinate, not desperate, just a regular urge, I want you to time something very specific. Go to the bathroom, stand at the toilet or sit down, whichever you prefer. Relax your pelvic floor. Don't push, don't strain, just relax and wait. Start counting in your head. 1 Mississippi, 2 Mississippi, 3 Mississippi. Count until the stream actually starts flowing. Write down that number. Here's how to interpret it. 0 to 3 seconds. Normal. Your sphincters are relaxing promptly and urine is flowing without obstruction. 4 to 7 seconds. Mild hesitancy. This is early stage obstruction or sphincter tension. Not urgent, but worth monitoring and potentially addressing with pelvic floor relaxation. 8 to 12 seconds. Moderate hesitancy. This indicates either prostate enlargement starting to compress the urethra or significant pelvic floor dysfunction. You should see a urologist within the next month. 13 plus seconds. Severe hesitancy. This is significant obstruction. The pathway is narrowed enough that it's taking substantial time for pressure to build and force urine through. See a urologist within 2 weeks. Do this test 3 times over 3 days, morning, afternoon, evening, because hesitancy can vary depending on bladder fullness. If you're consistently above 8 seconds, don't wait. That's your body's early warning system. Self-test number 2, the stream force test. This one is visual. And yes, I know it sounds strange, but it's remarkably accurate. The next time you urinate standing up, I want you to notice where your stream lands in the toilet bowl. Specifically, notice the arc. How far does the stream project outward before gravity pulls it downward? Here's the grading scale. Strong arc, 12 plus inches outward. Normal force. Your bladder is contracting effectively and there's minimal obstruction. This is what a healthy stream looks like. Moderate arc, 6 to 12 inches outward. Mild weakness. There's some loss of force, but the stream is still functional. This often corresponds to early prostate enlargement or mild bladder muscle weakening. Weak arc, less than 6 inches, nearly vertical drop. Significant obstruction. The urethra is narrowed enough that pressure is substantially reduced. This is pattern 3 territory. You need medical evaluation. No arc at all, straight down, dribbling. Severe obstruction or bladder failure. This requires urgent urological assessment. Again, test this 3 times over 3 days at different times. Bladder fullness affects force, so you want an average. If you're consistently in the weak or no arc category, that's actionable information. Self-test number 3, the post-void dribble count. This test measures how much urine is left behind and how long it takes to stop. After you finish urinating and you think you're done, don't immediately zip up or flush. Stay in position. Don't shake yet, just wait and count. Count how many seconds pass until absolutely no more urine comes out. Not dribbles, not drops, completely stopped. Here's the scale. 0 to 5 seconds, normal. A small amount of residual urine in the urethra is normal. Quick clearance means good sphincter control. 6 to 15 seconds, mild post-void dribbling. This usually indicates incomplete bladder emptying or weak pelvic floor muscles. You're leaving some urine behind. 16 to 30 seconds, moderate dribbling. Significant residual urine. This often correlates with prostate obstruction, causing incomplete emptying. 30 plus seconds or continuous leaking. Severe retention or sphincter dysfunction. You're leaving substantial urine in the bladder or urethra. Needs medical evaluation. If you're above 15 seconds consistently, you're not emptying completely, and that leftover urine is part of why you're waking up at night. Now, before we talk about what these tests mean and what to do, I need to give you critical safety information. There are 4 stream patterns that are medical emergencies. You need to recognize these immediately and seek care today, not next week. Emergency pattern 1. You feel desperate, painful urgency, but when you try to urinate, nothing comes out at all. Not a weak stream, nothing. That's complete urinary retention. This can damage your kidneys within hours. You need emergency catheter placement. Emergency pattern 2. Your stream is weak or absent, and you have severe pain in your lower back on one side, fever above 100.4 degrees, or chills. This suggests kidney infection or obstruction. Needs IV antibiotics and imaging today. Emergency pattern 3. You see frank blood in your urine, clearly red or brown, not just a tinge, and it's accompanied by inability to urinate or severe pain. This can indicate bleeding into the bladder that's forming clots and blocking the outlet. Needs emergency evaluation. Emergency pattern 4. Your stream changed suddenly, not gradually over months but overnight, and you're experiencing confusion, severe nausea, or extreme fatigue. This can indicate acute kidney injury from urinary backup. Needs emergency labs and imaging. If none of those apply to you, if your changes have been gradual and you can still urinate, then what I'm about to tell you is your action plan. But those 4 patterns, don't wait. Don't see how it goes. Get help today. Now, let's talk about what your test results mean. Here's the reality. Most doctors won't tell you this clearly. Your stream is not slowing down because you're getting older. It's not because you're drinking too much water. It's not because you're stressed. Those are myths. Your stream is changing because one of 4 mechanical things is happening inside your body. Possibility 1. Your prostate is enlarging and compressing your urethra. This is benign prostatic hyperplasia, or BPH. It's the most common cause of stream changes in men over 50. Possibility 2. Scar tissue is forming inside your urethra, creating a stricture. This can happen from infection, catheterization, trauma, or chronic inflammation. Possibility 3. Your bladder muscle is weakening. After years of pushing against obstruction, the detrusor muscle becomes overstretched and loses its ability to contract forcefully. Possibility 4. Nerve damage is disrupting the coordination between your bladder and sphincters. This can come from diabetes, spinal issues, or neurological conditions. The specific pattern of your hesitancy, force, and dribbling tells me which of these 4 is most likely. Let me walk you through what Robert discovered. Robert's self-tests showed this pattern: hesitancy, 8 seconds consistently, moderate, stream force, moderate arc, 8 to 10 inches, slightly reduced but functional, post-void dribble, 12 seconds, mild. That combination told me his problem was early-stage BPH with positional obstruction at the bladder neck. His bladder muscle was still strong, that's why he still had decent force. But the obstruction was causing hesitancy and incomplete emptying. We had 3 treatment options. Option 1, watchful waiting with lifestyle modification. Pelvic floor relaxation exercises, timed voiding, reduce caffeine. Option 2, alpha blocker medication like tamsulosin to relax smooth muscle around the prostate and improve flow. Option 3, minimally invasive procedure to physically open the obstructed area. Robert chose option 1 first. He wanted to avoid medication if possible. Here's exactly what he did. Robert's 5-part protocol. Part 1, pelvic floor relaxation training, twice daily. Every morning and evening, Robert spent 5 minutes doing deep diaphragmatic breathing combined with conscious pelvic floor release. Inhale for 4 counts, feeling the belly expand. Exhale for 6 counts, consciously relaxing the muscles around the bladder and sphincters. Repeat for 5 minutes. This retrained his body to release tension in the pelvic floor, which was contributing to hesitancy. Part 2, timed voiding every 2 to 3 hours. Instead of holding urine for 4, 5, 6 hours until his bladder was completely full, Robert set a timer and voided every 2.5 hours, whether he felt urgent or not. This reduced the pressure his bladder muscle had to generate to overcome the obstruction. Less pressure, less strain on the muscle. Part 3, double voiding before bed. Every night, Robert used the double voiding technique. Urinate, wait 30 seconds while sitting and leaning forward, try again. This ensured his bladder started the night as empty as possible, reducing nighttime wake-ups. Part 4, reduced caffeine and alcohol after 2 p.m. Caffeine and alcohol both irritate the bladder lining and increase urgency. By cutting them after early afternoon, Robert reduced bladder sensitivity. Part 5, daily walking, 30 minutes. Physical activity improves pelvic circulation and prevents fluid from pooling in the legs during the day. Better circulation, less nighttime fluid shift, fewer nighttime voids. Robert committed to this protocol for 8 weeks. Here's what happened. Week 1, hesitancy dropped from 8 seconds to 6 seconds. Noticeable improvement just from pelvic floor relaxation. Week 2, stream force improved slightly. Arc increased from 8 inches to 10 inches. Bladder muscle was responding to reduced strain. Week 4, hesitancy down to 4 seconds. Post-void dribble down to 6 seconds. Robert felt like he was emptying more completely. Week 6, hesitancy holding steady at 4 seconds. Nighttime wake-ups reduced from 2 per night to 1 per night because of better daytime emptying. Week 8, Robert's stream wasn't back to age 40 levels, but it was functional, consistent, and not progressing. His prostate size hadn't changed. It was still 42 grams, but his function had improved dramatically. His exact words, "I didn't need medication. I needed to stop fighting my body and start working with it." Now, Robert's pattern was mild to moderate. If your tests show severe hesitancy, weak force, and significant dribbling, lifestyle changes alone won't be enough. But here's the critical point. Even if you need medication or a procedure, doing these 5 protocol steps will maximize your results. Think of it this way. If you need medication, these steps make the medication work better. If you need a procedure, these steps help you recover faster and maintain function longer. Your stream is not destiny, it's information, and information gives you power. So here's what I want you to do tonight. Do all 3 self-tests. Write down your numbers, hesitancy timer, stream force arc, post-void dribble count. If you're in the normal range across all 3, hesitancy under 4 seconds, strong arc, dribble under 5 seconds, you're doing well. Keep monitoring every 6 months. If you're in the mild range, hesitancy 4 to 7 seconds, moderate arc, dribble 6 to 15 seconds. Start Robert's 5-part protocol today. Retest in 4 weeks. If you're improving, keep going. If you're not, see a urologist. If you're in the moderate to severe range, hesitancy over 8 seconds, weak or no arc, dribble over 15 seconds, make an appointment with a urologist this month. You need professional evaluation, flow studies, and likely medication or intervention. And if you're experiencing any of the 4 emergency patterns I described earlier, stop this video and seek care today. Don't guess. Don't wait. Your stream is giving you real-time data about your prostate, bladder, and urinary tract. Pay attention to it. Which pattern describes your stream? Tell me in the comments. Hesitancy time, arc distance, dribble count. I want to hear your baselines. And if this video gave you a concrete plan you didn't have before, type the word baseline in the comments. Let me know you're taking action. Subscribe to this channel. Turn on notifications. We're here every week with evidence-based guidance for men over 60 who deserve clear, honest medical information. Your body is talking to you every single day. It's time to start listening. Take care of yourself. You're worth it.